All right, case number 2. This is a 57-year-old lady who has a complicated medical history, but she is currently complaining of headaches, lethargy, and visual changes. A little bit more story, kind of a side issue here. She had a search and destroy head MR, and somebody said, oh my God, there it's in the cella. And she had repeat pituitary imaging. So how many of you are really stricken by that pituitary gland? Okay, cool. Everybody's very stricken by that pituitary gland. And I agree. It is expanding into the suprasellar cistern. It actually may slightly deform the chiasm. You know, I don't know how full of coffee you are, but, you know, it probably does violate that medial intercarotid line, right? Maybe. I'm thinking about cavernous sinus. I don't know. So let me just ask you a couple other questions in a very leading fashion. What do you think about the size of the cella overall?
Generous.
I like that word a lot. Generous. Because, you know, we've all seen macroadenomas in cellas that are like as big as a house. You know, it's like bigger than a bread box, but smaller than South America thing. And in this, I agree the cell is generous, but, you know, like I'm not like completely flipped out by it. It's, you know, it's big. So overall, any of the observations here, I think, first off, the gland is uniformly enlarged. There is no focal lesion here. And again, you know, no, I'll save that point for a moment. I'm going to come back to it in a minute. So you look at that gland, and you know the neurosurgeon comes by, and the neurosurgical fellow who's doing like a year of dedicated cellar, and you know they are all salivating to do cases, right? I mean that is, you know, that's why they're there. They want to do cases, and they look at this and they go over it with you, and you know, it's wow, big cell. In the room, what do you all think about this gland? What's your feeling? What's the kind of like the gut feeling overall? Would you say it's an adenoma and, you know, dictate on to the next case?
Physiologic hypertrophy.
Could it be?
She's older.
Mm-hmm.
Not pregnant, probably.
I think that's a perfectly appropriate thing to start thinking about. So let me, the observation, I'm just going to show you a 4-month follow-up examination of this patient. Same patient, no tricks here.
Taking any meds?
She was now. This is hyperplasia. This patient was on Synthroid. She'd been on long-standing Synthroid most of her life, but she'd stopped it. And in fact, on presentation, when she came, you know, feeling like kind of puny and, you know, not feeling so good, her TSH was 180. Now, in her follow-up examination, her follow-up TSH was 4. And interestingly enough, if you kind of remember, let's look back here, headaches, lethargy, she, kind of like going everywhere but nowhere kind of thing with her symptomatology, she had resumed her Synthroid, and strangely enough, she felt better. She was asymptomatic and kind of back to her normal self. So, point, if you don't see a focal lesion, it's always like, for me, it's that kind of woe back thing. You know, I always kind of like, the next questions I always ask myself is, first of all, is the cell really big? You know, is it big enough that I'm kind of happy saying that's just a huge cella and I'm cool with that? It couldn't be maybe an enlarged gland plus an incompetent diaphragma cella. And if you've been, you know, if you had 57 years of CSF pressures hammering on your gland, you know, your cella got big and, you know, there's some tissue down there and there you go. And this is another thing, and I'm fortunate and I have yet not had to do this, but you know, would you be happy reading a pathology note from the post-transsphenoidal resection of normal pituitary tissue? You know, and that therein lies the thing. Do you see a focal lesion? Because here's the deal. The differential diagnosis, if you think the gland is uniformly huge, it's got to be some autoimmune pituitary inflammation or hypophysitis thing, right? Because the whole gland is abnormal, right? There's not a focal mass. It's the thing that we kind of approached with the neurosurgeons is like, well, what are you going to resect? Because it's the whole gland. You know, and if you don't believe for a moment that the whole gland is abnormal, you know, maybe they're panhypopit, some kind of, I don't know, but if you can't buy that the whole gland is abnormal, there's nothing focal in that gland. And it's that idea, it's like, the worst thing in the whole world. Have any of you ever been called to the operating room to like look in the microscope with the neurosurgeon, to show them the lesion that you called? Because I have. And it is a horrible feeling. It is a horrible feeling. And, if you don't really see anything, what are you seeing? Well, I'm just seeing a big gland. And pituitary hyperplasia is a real phenomenon. This is like one of the most striking ones I've ever seen, but I got a few others in my collection. Kind of maybe an incompetent diaphragmacella, the empty cella thing with otherwise normal pituitary volume. But, that 4 months of Synthroid, that's a pretty serious drug. Okay, next case.